Matthew, hi. Thanks for helping me out.
Of course. It's a pleasure. And we know that there are others joining, so we're hopeful that this number will continue to go up.
Russ, I hope you had a nice day.
I can see the transcript recording on sign.
I did, April. I hope that you did similarly, and sorry to miss the meeting yesterday, but I'm sure you'll update me. I know we don't have time. We need to get rolling, but I'm wondering, Matthew, did you get the email from Borsica and me about if we have a chance to mention this special issue, the new special issue of Frontiers on adaptations?
Well, of course, you're able to say anything that you want to promote that. I think that would be wonderful, but I'm also going to defer to Bridget, who will really be guiding the discussion. But of course, we would love to hear that information.
Okay, and there's a further one, hoping you would say yes, is that Borsica has a slide on it, and she's also one of the co-editors. So I'm wondering if there's a way for her to share, I don't know if that's allowed or not, to either share a slide on it, or if she could email it to one of you that has permission.
We probably want to wait till more people join, because people won't see the chat until they've joined.
Yeah, it
So
can be
maybe
whenever.
an
It
intro.
could be at the end. It's up to Bridget and others whenever. But just if we could have a couple minutes to do it, I think that'd be great.
Sure. And let me also just say that we are officially live. We're just the only ones that people can see, but there are other people on at this time.
Thank you. Thank you. All right.
Okay, hi everyone. I apologize. There are some challenges for me getting on as a panelist today, but I'm here. So it looks like, okay, so we have April. Has Amanda joined yet? Yes, Amanda's on, and is Katie on? I think we're still waiting for Katie. Katie will be a little late. Okay, thanks, Matthew. So I guess while we're waiting for Katie to join so we can get the panel underway, Borsica's on. Borsica, can I give you like literally 2 minutes to talk about the announcement you and Russ have about the special issue?
That would be wonderful. I have a couple of slides. I'm going to try to share those. And I will ask Russ as well to jump in. Apologize, I have to put this into a presentation mode. And it sounds like our audience is here as well. Is that right, Bridget? Now we are ready.
People are starting to trickle in. So yeah, but I just want to make sure that we have enough time for the panel discussion. So I think these slides can be probably posted to the REAIM website after the session as well. So if you could just quickly go through them so we could jump to the panel.
Absolutely. Russ, would you like me to read it, or would you like to read it?
Please go ahead.
Okay, so this is a special issue that we are posting through Frontiers in Public Health and Frontiers in Health Services. So 2 separate journals will be involved with the posting of the manuscripts that are part of this research topic. The focus is on understanding, assessing, and guiding adaptations in public health and health systems interventions. And the hope is to find publications that can speak to the current state of the literature, but also think about the future. So kind of what is happening right now in this area of trying to document adaptations and evaluate them and identify their impact. But what is the next step for the field? You can see our editorial team listed on this slide. And as I mentioned, there are 2 separate frontiers that are involved with this so that we cover both the public health and health services impact. Very briefly, these are some important research topics or questions that we are interested in this special issue. I will highlight just a few of these. We want to understand what aspects of an intervention and an implementation strategy can be adopted and to what extent, and who decides about these adaptations. We also want to know what are pragmatic approaches to document adaptations systematically. How do we assess the impact of adaptations? Certainly a really important topic for us. And then how can we use real-time information about adaptations to guide improvement during implementation? We are, of course, also curious about contextual factors and how these influence adaptations and how we document based on that. And then finally, what are some meaningful ways of involving stakeholders in the documentation and understanding of adaptations? I'm not going to drop to much detail about the special issue topic focus, which you can find in the slides that we will post later. But I did want to highlight the timeline. We are looking for abstract submissions by February 1, and then manuscripts are due June 1. So this initial abstract, we will give you feedback whether we feel that it's a good fit with the special issue, and then your actual manuscript will be due June 1. And then we have the lead editor for this is Romana Yal from our team in Colorado. And so she's able to answer questions. And then Russ, if you want to add one more word on here, and then we will hand it back to the panel.
Yes,
Literally one word, Russ.
One sentence. How about that, Bridget? We give me
Okay.
one sentence. I want to stress that we love REAIM related applications, but this is broader than that, you know, and I'm sure this will come up in our discussion. Maybe it's a good segue to our discussion as we get going forward. So it doesn't have to be REAIM related. This is a huge issue, including the ISC3 collaboration that Dr. O, one of our panelists today, directs. So that's it.
Great. Thank you both. So as Borska had provided, there is an email if you have questions, or you could also connect with Borska in the chat during today's session. So it looks like we have all our panelists here, so we will go ahead and get started since we only have an hour for today's session. So good afternoon, or at least for most of you, good afternoon. For those of you on the West Coast, good morning still, and welcome to today's REAIM webinar. I'm Bridget Gaglio, and I will be the moderator for today's session. As hopefully most of you are aware, the 14th annual conference on the science of dissemination and implementation in health was held last month, unfortunately, again, virtually in mid-December. And the conference theme was broadening horizons for impact, incorporating multi-sectorial approaches into D&I science. So today's session here for the webinar is going to be focused on conference reflections, innovations, and thoughts on future directions for D&I science from the panel that is joining me today, which I would like to welcome April O from the National Cancer Institute, Amanda Mixon from Vanderbilt University Medical Center, and Katie Bro from Virginia Tech Carilion School of Medicine. Welcome and thank you for joining me today.
Thanks. Hi, everyone.
Good to see everyone. And Amanda, thank you so much for joining us, even with masked up and public health measures underway.
Yes, I'm working in the hospital, so lots of
Figured as
COVID.
much, but thank you for joining us. So first of all, before we get started with some questions I have for all of you today, I serve on or have served for the last several years on the actual planning committee for the conference and co-chair one of the tracks for the meeting. And so I just wanted to get a sense of what each of your involvement has been to date. If you've attended the conference before or anything of that nature before we jump into some of the questions I have for you.
So I guess I'll go first. So I've only been an attendee for several years, but not been on the planning committee.
Great.
And I can jump in. Hi, everyone, and thanks for the invitation. So I've attended to the D&I meeting for maybe 5 or 6 years now. My background is in community health promotion and in public health. So I wouldn't say I was necessarily trained in my doctorate degree around implementation science. So I see things more from a public health lens. And I've been involved with the DNI meeting, being at NCI on staff here, supporting our implementation science team. And also have also worked with grantees over the years and CDC colleagues in putting together different sessions, reviewing abstracts, et cetera. And I really encourage, I'm sure everyone on this call has reviewed abstracts for the meeting, but encourage you to continue to do that and submit abstracts too. Meeting planning for next year is already underway.
Yep, great. Thanks, April. And Katie, how about you?
Hi, I'm Katie. I'm a medical student at Virginia Tech. This is my first time attending the conference. I'm very new to implementation science, so it's really exciting to be invited. I feel a little not as well accredited as my fellow panelists, but I'm just very excited to be a part of it. I'm pretty new to implementation science, so it was an exciting meeting just to see the kind of work that's being done.
Great. No, we specifically targeted you because you're new to the field and to the conference. So we appreciate you joining the panel today because we definitely want to hear perspectives from individuals who are not as ingrained and living this day to day in their work. So, or have been for several years, I should say. Well, great. Well, thank you for sharing that with me. So I have prepared a few questions for you all, and I might, just to make it easier, call out on one of you to start, and then as you want to chime in, please feel free to jump in. So first of all, we'll start off with the opening plenary for the conference. I found to be very exciting and very timely. And so this was a presentation on health equity in D&I science, lessons learned and opportunities for advancement by Dr. Marcela Nunez-Smith, who is not only a researcher, but has served as a senior advisor on the White House COVID response team and has chaired the COVID-19 Health Equity Task Force. So in her conversation with David Chambers, they were able to incorporate all three of kind of the underlying conference themes for the meeting this year, which was advancing health equity in D&I science, building trust and engagement, and multi-sector D&I case studies. And so I just wanted to hear from each of you your thoughts about this session and kind of what resonated with you and what were your takeaways. And so Katie, being the new person, I think I'll start with you so we can hear your perspective.
Sure. I also really enjoyed the opening plenary. I thought it was really interesting, and Dr. Smith is so well spoken. It was it was great to hear from her, and I really resonated a lot with what she was saying about her coming to terms with health equity through medical education and kind of realizing like, okay, I'm learning all this physiology and how to take care of patients, but there is kind of that gap. And I really resonated with that because that's kind of how I came to implementation science and health equity, was realizing there was something missing from my medical education. So that little part of her speech I thought was very impactful, and I related to the most. And then the other thing that she said that I wrote down that I was like, oh, this is great, was her whole idea about continuous evaluation. So not only thinking about how we implement things, but continuously seeing what works, what doesn't work, figuring out how to de-implement the things that are not working. And I think that's something that's not really talked about, because we're always excited to introduce new ideas, introduce new programs, but also kind of recognize that not everything works like what we want it to, how we want it to. So knowing how to kind of backtrack and remove things that aren't working. But that's my big takeaway.
Great, thank you for sharing that. Amanda, how about you?
Yeah, so I actually I know of Dr. Nunez-Smith through a professional organization that we both are members of. And so I knew that she came from a very strong background of research and public health. And I was so excited to see that she was the keynote speaker that day, having served on, the president's task force. And she comes at it from a similar perspective as I do, from a sort of general internist perspective. And her work obviously has, over many years, has been focused on health equity. And she's really done groundbreaking work herself. And so one thing that I think she was an excellent selection to lead these COVID-related initiatives at the federal level. And, you know, I think similar to what Katie was saying is that she's having to see things get implemented in real time, essentially. And that is a little bit different than how we do things in research, right? We usually have more time and we may not see results for years. And so she has that unique perspective of being able to take something we're finding out in the clinical realm and putting it into practice and trying to do it across the whole country with varying results, right? You know, one thing that came up was about COVID vaccines, that there's no racial and ethnic differences in the uptake of the vaccines. But that doesn't mean that, you know, it's really equitable care across the country even still.
Great, thank you. And April, your thoughts?
Thanks so much. Yeah, I was super excited about the panel and just admire so much the work that was shared. And also, I think the leadership, because I think one of the great things about the talk, and for me, that was really engaging was, you know, this equity work is really challenging, and kicking off the conference to really be upfront about how hard the work really is, the motivations that she herself has for the equity work, and also really articulating so nicely that role of the physician scientist as well as public health advocate. And that while she wears this researcher hat, there's also the human hat, the maternal hat of her family, her community, you know, the role that we all play and the multiple hats that we play. And that identity really feeds into some of her motivation and drive and passion for the work that she does. What really resonated for me was there were a couple of different comments and examples that she shared of her own organization and how she's really trying to instill common values for the team, really focused on equity. What does equity mean? What is our target for equity? And how do we live that in the work that we do? Why are we doing this work, and who is it in service of? So I just really appreciated that, because I think that what my takeaway is that she is encouraging us as a field to come together as a community, thinking strategically about how we can leverage and work together to really identify what those equity targets are. So yeah, thanks.
Great. The other thing that really resonated with me with that session was her talking about partnership building and making relationships. And in time of crisis, that is not the time to be making or trying to establish relationships. And so it just made me think a lot about not only what the current context is in terms of responding and reacting to COVID, but also thinking about when we're doing D&I science research and we're putting together our grant applications, it's okay, do we keep drawing on the same relationships that we already have because that rapport and that relationship structure is there, which, you know, depending on the timeline, which is usually short, we do keep going back to those same collaborators. And so thinking about being more proactive in the relationships that we try to build and engage in to incorporate new voices and new opinions in the work that we do, I think is going to be very critical going forward. And so I really appreciated her sharing that with us as well. Which kind of lines up with the second thing I wanted to talk about, which was our the plenary that kicked off the second day, which was focused on multi-sectorial approaches to D&I science, building trust and engagement. So thinking about those relationships that we want to build and establish to move health equity and D&I science forward. And Lisa Simpson had started off the introduction for that plenary with a quote that said, change happens at the speed of trust. And so I wanted to hear each of your reactions on that statement as it relates to D&I science. And I think this time we'll start off with Amanda.
Yeah, that was a great quote. I wrote it down, and probably a lot of other people did too. You know, I remember going to the D&I meeting several years ago, and there was like a whole session on relationships. And so this sort of resonated back with that. One other thing that struck me was that somebody said it's never too early to start engagement. And I think that was a really good message for me to hear, because I always think, like you're saying, Bridget, when we're thinking about a grant application, okay, now who can we, talk to engage, but we need to be doing it all along and building those relationships. I also, that quote also made me think about the relationships that I have built with like clinical partners and trying to implement. I've worked a lot with sort of toolkits in hospitals and things like that. And it really does reflect the time that you invest and listening to your stakeholders in order for the outcomes to be what you all desire. And I think that the time invested is never wasted. Even if they're, very resistant, there's a lot of barriers to the implementation. I think it's well worth it over time.
Great, thank you. And April, what are your thoughts and reactions to that quote that Lisa shared with us?
Thanks so much. And thanks for sharing your thoughts, Amanda. A couple of things. So one of the hats I wear is around program side at NCI. And what that means is working with our scientific staff and developing funding announcements, and also working with investigators to hear about some of the opportunities or challenges they're experiencing as they're conducting their research. And recently, I've been a part of the Common Fund Transformative Health Disparities Initiative, and that comment really struck a chord with the work there, and some of the other sort of funding announcements that we've had coming out of NIH recently in the last 2 years around health equity and health disparities, and several of those do include or prioritize or emphasize community partnership. And one of those is the RADx Up initiative. And some of the things that we've been hearing back from those projects is around some of the misalignment between funding cycles as well as community timeframes. And I think that we've heard that also in multiple other sessions throughout the D&I conference. That was a thematic that kept coming up again and again following, sort of hearing that quote. I think people were really reflecting about what that meant within their own work. And Bridget, you were asking about sort of those grant cycles. One thing that I had been hearing back from other folks too, other investigators, is, there are, different departments, public health, there's different disciplines, there's different staff. I think one of the key pieces is also knowing that the health equity work has been going on for quite a while, has a long history. There have been scholars who have been working in those areas for quite a long time and have had experiences and challenges with either not being included in science or other sort of structural barriers to having acceptance of their work. So I would encourage folks to think about their team. Who is on your team? And are there ways that we could really leverage the expertise, experience, and time of others, but also in conjunction with that, also recognizing that there is also burnout. We're all burnt out. We've been in this pandemic for quite some time now, and it seems like, when is the end coming? So I think a bit of careful consideration, open conversation, communication, and trust around that would be important. And then the second thing, sorry, one more piece, is there was a really great coffee talk I hope that was recorded. Maybe on the second or third day of the DNI meeting that Heather Brandt and Shobha Ramadanan had led. And they put together a really nice active Google document that's a shared document. And I think if I can find the link, I'll put it in the chat. But they put together sort of crowdsourcing within that coffee talk, different resources and thinking about trust and engagement. And it does, one of my takeaways there was it does seem that there is a real desire within the DNI community to learn from each other about the best ways to leverage and build trust and sustainability around that.
Great, thank you, April. And yes, if you could find that resource, we'll share that with folks who might not have attended the conference and won't have access to, I believe, for at least a little while longer, all of the sessions that were recorded are still available on the conference website, and you can just use your login information to go back and either rewatch sessions you attended or be able to look at and watch sessions that you might not have been able to do because they were competing with other sessions at the same time. So, but good question. I'm not sure if the coffee chat was video recorded or not, but we'll go back and take a look. And Katie, share some of your thoughts with us.
Sure. So I liked what Amanda said about thinking about not only making contact once with that population that you want to work with, and like not just showing up when you want to do something for your research, but really being involved with that community, attending the community events, attending different life events that you're able to. And I really liked what you said about the amount of time spent is never wasted. I think anything that you can do that builds trust is really, really helpful, even if that doesn't necessarily progress your own research. The other thing that I wrote down from that talk that I really loved was thinking about trust as an outcome measure. So making that like part of your research question, like our goal for the research is not only to develop this program or like collect all this data, but actually thinking about like, how do we make ourselves trustworthy to this population? Because especially thinking about health equity, there's a lot of populations that are inherently not trustworthy of research or healthcare, things like that. So I think pulling in the correct people to think about how our end goal can be to not only do what we want to do in a research sense, but build trust so that they're more likely to participate in research in the future as well. So I thought that was a really interesting talk. And I had to watch that recording one because unfortunately I was in the clinic, and I think I've watched it twice now because I really liked that session.
Yeah, no, it was a great session and a wonderful way to start off day 2 of the conference. It also, that comment made me think a little bit, not only about, because I do come from, been at PCORI for several years, and so have, ingrained in thoughts and how I think about things, the patient and stakeholder engagement, and that it should start early and occur often and across, the entire research continuum. But the other thing that statement made me think of was also building trust with colleagues and collaborators in other disciplines, like April had mentioned in her comment, that we might not typically work with. And so really, starting to be not only more thoughtful when we're thinking about potential research questions that might be able to address health issues, to be thinking about, who are the key patients and stakeholders from the healthcare perspective, but who also might have better expertise than us, that from maybe the academic side, that should also be included. And how do you go about starting to work with those folks and building and creating trust and relationships with them as well? And so it just made me really think about kind of really stepping back and looking at all the components of who's involved in a research project and where we could be doing better. So with that, I think we'll talk about the final plenary, and then I have a couple other areas where I did want to focus on. that final plenary I also found to be extremely interesting. And again, weaving in all three of kind of the sub-themes of the conference in terms of health equity and building trust and the multi-sector approaches to healthcare and addressing health issues. And I thought this was a great example to kind of really finish the conference on, which was which is a discussion, I guess, about veteran health and the need for multi-sectoral approaches to achieve successful transitions to clinician life, or civilian life, civilian life and health outcomes. And so hearing about the examples that they've used to really bring in these diverse groups to help the veteran population of this country, I found to be really interesting. And so I wanted to hear from each of you how you thought this related to maybe future directions for D&I science and how we address health issues. So we'll start off with you this time, April.
Great, thanks so much for that really hard question.
Sorry, I didn't mean for it to be a showstopper.
No, not at all. I just, just reflecting on it, my training and orientation around that really just starts to think about sort of the why for multi-sectoral. And I thought there was a really nice example for that was presented, and sort of the impacts it has on both the system and then also the patients and their families. But in terms of then sort of taking that into sort of other health outcomes, et cetera, and thinking about equity, makes me think about sort of how can we better include social determinants of health in our inquiry, in implementation science, and in the questions that we ask, because these are intersecting and overlapping systems, as we all know, and they reinforce one another. So making change in one does have ripple effects, but if we're not capturing that's a challenge. And certainly for policy implementation research, that's something that's really important. I think there's one example of with the ACA, where one of the interventions as part of that was to offer an incentive to providers to promote cancer screening. However, in terms of the actual uptake of cancer screening, the impact was not as much as we might have expected. And that was because there are other overlapping systems that were intersecting with that particular policy. And there are also many other reasons we can all probably sit together as scientists and talk about. But that's one example that reminds me that if we do not think about how the healthcare system intersects with some of these other systems, then sort of our implementation outcomes will be challenged. Also, as we think about sustainability and scale up, there's going to be those challenges as well. It's not easy. And I think for one of the key pieces that the questions that I get around this is, so if we are trying to promote a portfolio around multi-sectoral or cross-sectoral interventions, the why, that's not part of the healthcare mission. And I wonder if some of you, as part of this network, have that sort of question that you either your department chair or your mentor or even some of your partners may be asking you, why would we include these other sectors? Why are we looking at transportation? We're trying to increase screening. And I think that there's an important communication challenge for all of us when we're doing that, sort of the communication to our members of our team, communication to our partners about the value for those and the potential impact. And then also there's the communication to those particular sectors themselves. Why is it that the transportation department needs to care about health? And maybe they don't end up caring about health, and that's totally cool. But this is how your transportation is impacted if we aren't thinking about health. So I think that it presents in of itself larger questions about other opportunities and things that we could be thinking about. Sorry, I'll stop there.
Oh, great. Thank you. That was very interesting. Thank you for sharing your thoughts. Amanda, how about you?
So I missed that session, but what I can say is I'm working in the VA right now and I'm taking care of veterans, and I have for almost 20 years. And I also am working on an exciting project with IBM around health equity and creating dashboards in hospitals to identify patients who have needs, social determinants of health needs. So just like what April was saying, the VA has created a dashboard to look at health equity by race, ethnicity, gender, things like that. But you know what this project with IBM is pushing towards is like, how do we see all the needs? Because we know that if 50% of health is related to social determinants of health, if we don't pay any attention to 50% of that, then the prescription that I give you or to a veteran and they can't pick it up at an outside pharmacy because they don't have transportation and they don't have heating in their home, you know, or a refrigerator to keep their insulin, it's pretty pointless. So these have to be addressed in order for everybody's health to be, you know, better than it is now. So, I mean, I see it every day as I'm trying to discharge patients home, you know, that if we, our work as clinicians only can go so far. And so we have to create these partnerships with other sectors in order to raise the quality of life for our patients.
Completely agree. Completely agree. And Katie, how about you?
All right. So the final little panel I also really enjoyed, and the part that I really liked was when they were talking about how you bring equity into your day-to-day life, which is something that I've been thinking about a lot, especially since I'm planning on being a clinician, mostly working in a clinical setting, and I want to be intentional about thinking about equity, both on like the individual patient level and then in the terms of D&I science. And I really liked what they were saying about asking different research questions. So thinking about, are we asking the right questions in the first place? And do we need to pull in different people when we're asking our research questions? And then do we need to be asking other people what kind of questions we should be asking? Just really trying to be intentional about bringing in all those different lenses. And then the other thing that I really liked that they talked about was when we enter different spaces, and especially in times of crises, noticing or recognizing that whatever situation you're in is not accidental. There's a lot of systems and policies and prior events that kind of created this whatever space you're working in. So I think being cognizant of all the other things that are going on in that community and how that's going to impact your intervention is really important, especially moving forward. I think we can't not talk about equity in anything that we do. So I think that's very, very important for future directions, and something that I personally really want to work on, both as like a practitioner, but also as a researcher.
Yes, something for all of us to think about how we can better include that in the work that we're doing as our careers continue to move forward, and how best to serve the individuals that we're trying to help, but also really making equity a much more prominent focus of the work that we're doing. Well, great. Thank you. I appreciate you all sharing your reactions to that session. I thought that, like I said, again, it was a nice way to end the conference with kind of real example of how multi-sectorial approaches have been brought together to try to increase better health outcomes for our veterans in this country. So I want to transition a little bit to just looking at the time, make sure we're staying on time. I would like to leave a little bit of time at the end for Q&A from the audience as a whole. So we'll make sure that that's something that we can do. Several of the sessions that I attended, I'm not sure about all of you, but curious to hear your thoughts, presented work about, or in the context of how quickly context is changing. Obviously, COVID-19 response is changing by the minute, but just there were other examples of how quickly context is changing along with the responsiveness to changes in the evidence. And so I wanted to hear from each of you your thoughts on the needs and future directions for D&I science, and how we might be able to better capture and understand the acceleration of these changes over time. I should call on someone. So we'll go with Amanda.
Yeah, I mean, I think about this a lot because trying to stay up with the evidence is like, you know, drinking from a fire hose, even more so now. I think now that just during COVID, trying to understand literally week to week how the care that we provide changes and what public health measures we should be taking. I think one thing that we have to move the needle on, and this is going to take methodologic work, is, you know, how do we plan for studies knowing things are going to change during the implementation of the study. And what I especially need help with, I think, is knowing how to thoughtfully plan the sort of statistical work around that. So making sure that we have enough power and in data collection to show, you know, as things are changing, how much data do we need at each of those time points, and making sure that we have very sophisticated ways to demonstrate our outcomes.
Yes, that is definitely a need. Indeed. Katie, how about you? What are your thoughts about how, how can the D&I science, what can we do to help capture and understand the acceleration of all of these changes over time as we're trying to do our research?
Yeah, sure. So something I've also learned just starting out in this research field is knowing that I have to continue to kind of touch base with people who know what they're doing. So not only people who have like the academic expertise, but all the people who have the lived experience. I think someone called it like life expertise, which I really liked. So I think keeping grounded by like constantly making sure that I have those connections whenever you're lost, just going back to the people who know what's going on, and that might be the stakeholders or mentors or whoever else. So I think kind of keeping those people close. And then also I think appreciating that it's good that everything's accelerating. I think it's good, change is good. So when it gets overwhelming, just thinking about how far we've come, I think is really important, because it's really easy to get lost in all of that. So yeah, I think just keeping grounded and making sure that you're talking to the right people. It's overwhelming, even just especially for me trying to learn all of this and then also trying to keep up with everything has been difficult, but I appreciate all the help I've been getting, and then all the opportunities to talk to different people with a lot of different life experiences.
Well, great, thank you. Yeah, I think from a methods perspective, trying to understand and capture adaptations over time is going to continue to be a challenge for us. So if there's anyone out there that's really interested in focusing on methodology issues, this would be a great space for you, along with the statistical implications for it. But April, I think from a public health perspective, I think, maybe trying to implement public health interventions that might be longer term in duration, but know that they're going to change, or the context in which they're being implemented is changing over time. What your thoughts are on how D&I science might be able to do a better job of capturing these adaptations and understanding the impact on the final, outcomes when we get there.
Mm-hmm. Okay, great, thanks. Another good one. Bridget. So, I was thinking about this because you did give us the questions in advance, so I'm just giving you a hard time.
No, I know. I didn't want to be too rude and just be like blindside you during the presentation.
So, I, prior to working in implementation science, I worked in health communication and informatics at NCI. And this is a question that we were always asking, because the health communication environment is constantly changing. And as you're developing messages, you have to be rapidly responsive to context. And we live in prior to the pandemic, we lived in a 24-hour news cycle. And now we have that still. And on top of that, we have lots of experts. We have lots of, at-home couch epidemiologists. We have a lot of experts in like school education and education and policy suddenly, and that's really fantastic. I think that's a really important goal for all of us to have this democratization of science, but also we have to think about literacy. We also have to think about misinformation and that role of misinformation and the other voices in the communication environment that are influencing our ability to be able to accomplish the goals that we might have for implementation. And that is going to require paying attention to those broader contextual factors. So it is low-hanging fruit to me to, use some of those other tools that other industries and disciplines have used in essentially sort of monitoring the environment. So social media for its like pros and cons, strengths and weaknesses, or as some may say, the devil. There are some ways to get some really fast engagement statistics and start to see some trends in terms of, how one message or one event may be impacting other things. The challenge, I think that's always going to be a challenge with these sort of things is that, what Dr. Nunez-Smith did say is that one of the biggest challenges with equity is that it is also very super hyper local, right? And so what is happening in the local community in Arlington, Virginia, where I live, is super different from where my parents live in Concord, North Carolina. So, the issues are different. So coming up with a one size fits all, as much as we want to, becomes really challenging. I also think that there are some, emerging methodologies as well as methodologies in other disciplines, user-centered design, for example. And I know IS there have been some really good examples in applying that in implementation science that could be helpful. There are also, some who really think that maybe if we start to develop this broader data ecosystem where we all could contribute data, and that's a priority at several ICs across NIH. If we could contribute all to this data ecosystem where we're able to access and learn from and hopefully updating in real time what that potential might be. I think there's strengths and limits to that, again, having to do with that sort of equity being a really local issue too. And I'd also really encourage mixed methods approaches and thinking beyond the traditional RCT for a lot of this work as well.
Great, thank you. And I definitely concur with that last point that's been made, that you made. Well, we're gonna open up to the public for Q&A here shortly, but I would like to just quickly ask each of you one last question. If there was a specific poster or podium presentation that really called out to you or stood out to you during the conference, and if so, what it was and why. I'll start with you, Katie.
Oh, sure. Okay, I actually have it pulled up. So there was one poster that I was looking at that I really liked, and it was implementation of a postpartum obstetric navigation. So I'm interested in going into OBGYN. So anytime there was any kind of maternal health poster, I was like, oh, I gotta look at that one. And I thought this one was so interesting because a lot of issue, like you can think about access to prenatal care and access to good medical interventions during birth, but then once people have their children, you kind of forget about the postpartum period. And I think there's a lot of opportunity to intervene in this specific time point, because a lot of these women and people who have given birth may have never seen a physician before they became pregnant. So kind of making sure they're all caught up in this postpartum period is super, super important and is very overlooked. I mean, I thought this was a really interesting approach to addressing this issue, where they had basically one-on-one navigators to help these people kind of find the different, if they had problems with food security, if they had problems with transportation. So moving beyond just like their medical problems, but thinking about how they connect people to different local resources during this time point. I thought this was a really great poster. It was Green et al. From Northwestern University. And it was an RCT just kind of piloting this program, and they had some really interesting results.
Great, thank you. It sounds very interesting. Yes, and that kind of tying back into what we were talking about earlier is like looking at the person in their whole context and not just the health condition that they're presenting with. So great, thank you. Amanda, how about you?
I think this was the second day's focus on trust during the keynote address. The question that came up was, what are your community's assets? So instead of focusing on the community's deficits, which we often do, they don't have enough of this, they need that. What are the assets and building on the assets? I thought that was a really great point, that sometimes we forget that we have so much richness and the living experience, as you brought up, Katie, in the communities to advise us on the relevant research questions that we should be asking. So I really liked thinking about community assets.
Yes, that's great. And yeah, sometimes we do look at things in a very negative perspective. And so flipping it and trying to identify the positives that we can continue to build off of is always, yes, a good reminder that we should be doing that. And I agree that we don't do it enough. And April, last comments for you about your favorite session that spoke out to you.
Well, I was just trying to Google here. I really, she is like my spiritual gangster. Hermina Palacio, her talk, oh my gosh, it was so good. And for those of you who are not able to be there, I am going to put her bio in the chat so that you can see. But I was just so struck by her passion and use of science for activism and science to communicate, really thinking about science and data as empowerment. And we talk a lot about power and health equity, and that really resonated with me. And also, I would be super remiss if I did not also highlight the ISC3 session discussing health equity research methods. And the key piece that I want to highlight were our investigators, Kelly Aschenbrenner, Amy Hubishman, and Nat Hugay, who shared some lessons learned in applying health equity lens to implementation science methods. And it is tough work, and it's a lot of new territory with some of the partners, but also in terms of thinking about how to frame the research questions, how to intentionally include and more explicitly include health equity in the work. I thought that was a really nice session to go back and listen to as well. And I also really enjoyed all of the coffee talks because I thought that everyone came there so interested in learning and in sharing, and appreciate too Prajakta Adsul's leadership on those coffee talks and sharing different resources, expertise and experiences.
Great, thank you. Yeah, the coffee talks were interesting, and I feel like, because we didn't have the opportunity to network like we normally would at the meetings in person, it was, the best thing that we could come up with in a virtual format. And so I think hopefully those of you who attended got some value out of it and were able to connect with other folks that were interested in similar topics as you were when you were attending the meeting. With that, I know we have a few minutes left. I do want to see if there are any questions from anyone out in the audience for any of our panelists today. You can either use the Q&A feature, pop it in the chat, and we will get those asked, because I don't think anyone else can speak except for a few select people from the REAIM steering committee. So yeah, if you have any questions, now is the time. Looks like we've had a lively discussion going in the chat, which is great. But yes, feel free to either use the Q&A feature or type in the question. Give folks a minute here. All right, well, while we're waiting to see if there's any questions from anyone, as for the REAIM steering committee, are there any other announcements that anyone would like to make while we have a captive audience? And I knew Russ was going to come on immediately. So, so Russ, you obviously have something. So what would you like to share?
Touche. You couldn't pass up an opportunity to could you? It's actually related, just a comment related to the meeting, but also specifically to REAIM. And I just wanted to say that I imagine a few of you went to, there's a new version of CFER coming out, and there are several related publications. And the thing I wanted to call your attention to, and we might want to follow up on, is they have an appendix. There wasn't a great deal of discussion of this, but there's a in-press publication related to adding outcomes to CFER, which related, number of those, of course, relate and are very overlapping with REAIM outcomes. But one thing I found intriguing, and I know is an interest of Paul's too, is they're breaking down implementation outcomes into two types. One of them that they call perceived outcomes, and that includes things like perceived acceptability and feasibility, and then observed outcomes, which are most of our REAIM outcomes there. And I just thought that's interesting, and it'll be something that's fun to track. And then my last comment, and I apologize if somebody already said this, I had to step away a moment, but in the closing session, I thought one of the great comments was about how important what the questions are that we ask and don't act, and the quote that just even asking a question or framing this is a political act itself, I thought was a takeaway.
Great, thanks, Russ. And yes, I am pretty sure the CFER 2.0 presentation was probably attended by almost everyone on this meeting. I think everyone was very interested to hear what changes and updates were going to be made to that framework. Let's see. I'm not seeing any questions in the Q&A or any that came through the chat. Joanne had made a comment about Russ having you say a little bit more about the perceived outcomes that is part of the CFER update.
I'll just say a sentence, and there's more to come. Maybe we can circulate the publication, or maybe even we might want to do one again. As I mentioned to Paul, I think has written a bit on this, and I know is quite interested in one of the prior issues of Frontiers. But as I understand it, the notion is that there may be a sequence of implementation outcomes. Rather, we all know they're related to each other, but rather than they're all occurring simultaneously, that there may be earlier things like that are more proximal to doing something, like just the perceived, even at the planning stage, when you're looking at perceived acceptability or feasibility, and maybe that even creates a go, no go. Okay, but that historically, particularly in like the Proctor outcomes model and things, that those are considered key factors. But the notion that they themselves may be, if you use the term determinants, or mechanisms, or whatever term you would like, at least related in the chain to then the later outcomes that we usually focus on. And of course, we know that many of the REAIM outcomes are related to, like if you don't have decent reach and inequitable reach, you're not going to have much overall population impact.
Great, thank you. And yes, I think maybe one of us through the steering committee might be able to disseminate that paper through the listserv, or at least provide the link for where that can be found after this webinar today. So with that, I do not see any other questions or comments. So I would like to say thank you very much to Katie, Amanda, and April for joining me today to talk about their experiences and their thoughts about attending the DNI conference last month. I hope all of you had a similar experience and found the conference to be very interesting, very engaging, and very thought-provoking. So with that, thank you all for attending today, and we look forward to seeing and speaking with you at future REAIM webinars. I hope you all have a great rest of the day.
Thanks so
you.
much, Bridget. Good to see
Thank
all of
you.
you. Thanks for the invitation.
Of course,
Yeah.
great to see you all.
Thanks, everybody.
Be well, everyone.
Bye.
Bye.